I think I'll stay seated for a minute here while we're on the topic of trans. No secret probably to most viewers, unless you've been living under a rock, you know who I am here in St. John's. I moved here 4 years ago, came out as a transsexual shortly thereafter, and started the long, expensive, lonely journey of becoming Jennifer. The World Professional Association for Transgender Health is a globally recognized body. They've created the standards of care. It's accepted in many parts of the world. It's not recognized here in Newfoundland. I went looking for medical resources and had a very tough time to find doctors willing to work with me. I found an old, out-of-date piece of legislation written by our provincial government's Department of Health and Community Services that says that if I want any type of trans surgery, I would have to go to a clinic in Toronto known as CAMH, an organization that has been denounced by quite a few medical professionals around the world for their old and out-of-dated practice of considering this a mental illness. I think the statistics show that hormone replacements, therapy, and sex reassignment surgery is the one and only way to resolve this medical condition. Furthermore, human rights is a major issue that the trans community in Newfoundland face. Our Human Rights Code was recently amended to become a Human Rights Act, and our Minister of Justice elected not to protect trans people. The words gender identity and gender expression were not added, even though they are consistently being added to human rights codes around the world. Trans people face all sorts of challenges along with the medical issues. I had a very good job. Then I came out as trans and I lost that job. I can't prove anything, but since then I've gone looking for work at the same level and have been unable to secure anything. Over 50 job interviews in 3 years. I went from earning over $60,000 to be a senior analyst to being a file clerk earning half as much. Specific medical resources. The standards of care are actually quite easy to implement. It doesn't take a specialty or specialist, a psychiatrist, a psychologist, and a family doctor. It's all you need. It's all I needed. I managed to find resources right here in the St. John's area. Brought them the standards of care and explained to them how it worked, and they were on board. They were all for it. Fortunately, the money is a major issue. I ended up having to travel on my own money several times to Toronto, to Philadelphia, to Boston, to Montreal to get medical resources. I think my count is up to $50,000, and it's pretty tough when you're only earning $30 per year and you got to pay your rent and buy food and all that good stuff. The East Coast Trans Alliance. The strength in numbers. There's so few trans people that are out in Newfoundland, heck, in New Brunswick, Nova Scotia, Prince Edward Island. I have recently reached out and found at least a few in each province, and the eastern provinces tend to struggle even more than some of the bigger provinces, such as Ontario, Quebec, and British Columbia, who are a little more advanced in their trans products and services and legislation. It is my goal, one, to kind of formalize a peer support network. If you go to Google right now, type in Newfoundland transsexual resources, you're probably going to get me, and me. And that's not totally ideal. I don't think it should have to be me. I think there should be a healthcare, government health entities out there that will do this. I'm happy to do the best I can. I'd like to try to formalize it because I can't necessarily give you medical or legal advice. And furthermore, strength in numbers. Trans people, we lag behind in just about every category, and we need to stand up and demand equality, demand the human rights, demand the health care, and that's what the East Coast Trans Alliance is all about. So I just wanted to quickly throw that in. It's been a great